Dana-Farber is this amazing machinery of translational research from bench to bedside. One of the things I really wanted to do was to get this clinical implementation translated to the region of our focus, Middle East and North Africa. Every morning I would think to myself when I came to work, how can I translate this? My name is Navid Madani, and I'm the founding director of the Science Health Education She Center. A lot of the work that we have been doing is around burden of the disease. There is a lot of stigma associated with the word cancer, and then on top of it, there's more stigma around reproductive cancers of women, especially breast cancer. Breast cancer is #1 cancer in the Middle East and North Africa. The onset of it is 10 years earlier than in the West. And when people come to get treated, they're usually a stage 3 or 4. So they hit it.
The survival rates are as low as 40% in some of these countries. So most probably, if you know someone who was diagnosed with a breast cancer, the chances that they won't be able to survive it are kind of high. While in the US, the survival can be as high as 90%.
Advocacy and education is really important to decrease this black cloud that's around the word cancer.
The She Center has 3 main pillars. The first one is education, and this is directed to the researchers, healthcare providers, and the public through the workshops that we deliver. The second one would be research, connecting people from Dana-Farber with researchers and healthcare professionals in the MENA region. I think it's about empowering the young generation and also the healthcare professionals and researchers, especially in the cancer field in the Middle East and North Africa. And the third one would be advocacy through the Tea Time with She, through the She Walks that we have done in Boston, we have done in Jordan. We bring this community together to heal together.
One of the things I love about Dana-Farber is the Jimmy Fund Walk, seeing how the whole community in Boston comes together to defy cancer. This is a culture that not very many places have. I'm quite privileged to be here as a scientist, as a healthcare provider now, as a mentor, and now as a patient. And now as a patient, I'm even more determined because I see patients in the resource-limited settings of MENA region, and I want for them to have what I have here. And going through the double doors of Dana-Farber and thinking that I want to have a Dana-Farber in the Middle East has not changed.